client's medical record. Next is prepare the necessary equipment that will be needed. So we will be use the hand light, centimeter ruler, a rectangular card, and a stethoscope. And next is to perform hand hygiene. Good morning, sir. I am Maria Cushalvi Castillo, your student nurse for today. So may I clarify, sir? Can you state your name,
I am Kian James Montenegro.
your birthday?
I'm October 30, 2002.
How about your age?
I'm 19 years old.
Okay, so what would you like me to call you?
Just Kian.
Okay, Kian. So I will be doing an assessment about your cardiovascular system or your heart. And I will be touching and also assessing some parts of your body. Is that alright with you?
Yes, okay.
Okay, so as for your privacy, Kian, all the information will be safely handed to the attending physician and other healthcare personnel that will be taking care of you. So do you have any question, concerns, or clarifications?
No,
Okay, so may I start? Do you have any complaint or pain in your chest?
no ma'am.
Shortness of breath?
No ma'am.
How about dizziness and headache?
No ma'am.
Okay, so do you feel comfortable right now?
Yes ma'am.
Okay, so have you had any history of surgery?
No ma'am.
How about asthma?
No ma'am.
Hypertension?
No ma'am.
Okay, so does anyone from your family have asthma?
No ma'am.
Heart failure?
No ma'am.
Had been stroke?
No ma'am.
Okay, so may I ask, do you smoke or drinks alcohol?
No ma'am.
Okay, so what are your usual activities?
Playing basketball, going school.
Okay, it's okay. So is there something in your workplace or house that may result you have chest pain or shortness of breath?
No ma'am.
Okay, so do you exercise?
Yes ma'am.
Eat 3 days a meal?
Yes ma'am.
Okay. Now we begin the assessment. Let's get started with the assessing your jugular veins and your carotid arteries. In assessing the jugular vein, position the client in supine and elevate the head of the bed between 30 and 45 degrees, making sure that the head and torso are on the same level. Next is turn the patient's head slightly away from the side being examined and shine a tangential light onto the neck and suprasternal notch and area around the clavicles to observe pulsations and shadows. So, sir, can you decide? If jugular distension was noted, assess the jugular venous pressure and locate the highest visible point of the internal jugular vein. Next, as deemed necessary, raise or lower the head of the bed until the highest visible point of distension could be observed. Note that the jugular vein should not be distended, bulging, or protruding at 45 degrees or greater. If so, it may indicate a right-sided heart failure. Next is measure the vertical distance in centimeter above sternal angle by extending a long rectangular card horizontally and a centimeter ruler vertically, making an exact right angle. And repeat the preceding step on the other side. Next is in assessing the carotid arteries. Elevate the head of the bed 30 degrees and position the patient's head slightly towards the side being examined. Palpate the carotid cautiously, avoiding too much pressure or massaging the area to avoid blocking the circulation or triggering a vagal stimulation. Sir? Next is to repeat the preceding steps on the other side. Next is place the bell of the stethoscope over the carotid artery. Ask the patient to hold his breath and auscultate to listen for bruits, which is a blowing or swishing sound caused by a turbulent blood flow through a narrow vessel. Can you inhale? Exhale. Inhale. Inhale. Exhale. And repeat the preceding steps on the other side. Next is the assessment of the heart. First is to inspect and palpate. Begin with a general inspection of the chest wall and look for any abnormal pulsations, symmetry of movement, retraction or heaves, which are strong outward thrust of the chest. Next is simultaneously inspect the pericardium for pulsations while palpating the aortic, pulmonic, tricuspid, and the apical area. To palpate for heaves and lifts, using the palm or hold the finger pads flatly or obliquely against the chest. Next is press the ball of the hand firmly on the chest and feel for thrills, which is a buzzing or vibratory sensation caused by underlying turbulent flow. Next is palpate impulses using finger pads flatly or obliquely on the aortic area, pulmonic, tricuspid, and the apical area. Next is palpate the apical impulse using the palmar surface of 2 or 3 middle fingers. For finer assessment, palpate with 1 finger alone to confirm characteristics of the impulse, noting for its location, diameter, and amplitude. If unable to palpate the apical impulse with the patient supine, reposition the patient to roll partly on his left lateral side and palpate again. If it's still unable, ask the patient to exhale fully and hold for a second and palpate again while maintaining to be partly facing his left side. Okay, sir, can you face your left side? No, sir, no. So, sir, can you inhale, exhale, inhale, and then hold it for me, sir. Okay, sir. Can you hold that? And inspect and palpate the epigastric area. So in auscultation is assess the heart rate and rhythm of the patients by placing the diaphragm of the stethoscope on the patient's apical area. If an irregular rhythm is detected, assess for pulse rate deficit. Using the diagram of the stethoscope first, then the bell, auscultate the heart in all four anatomic sites, which is the aortic, pulmonic, tricuspid, and the apical or mitral area. For heart sounds, extra heart sounds, and murmurs. So first, we will be auscultating the aortic area, which is the region of the chest wall over the second right costal cartilage, where sounds produced at the aortic orifice are often best heard. Sir? Next is we will be auscultating the pulmonic area, which is the second interspace to the left of the sternum. Next is we will be auscultating the tricuspid, which is the left fourth intercostal space, just lateral to the sternum. This is where the tricuspid valve sounds are best auscultated. And lastly, the apical area, which is the fifth intercostal space, left mid-clavicular line. Repeat the preceding steps while patient is in left lateral position. Then, at sitting position, leaning forward and briefly stop breathing after exhalation. So, sir, can you face your left side? Sir, can you sit down and lean forward. So, sir, can you inhale, exhale, inhale, and then hold it for me, sir. Okay, you can exhale. So next is the assessment of the peripheral vascular system. So first we will be examining the upper extremities, which is assess each arm for size, symmetry, skin color, and temperature from fingertips to shoulder. Next is note for any edema, lesions, changes in skin texture, and hair distribution. So sir, can I see your hands, arms? Be checking temperature. Can I see the other hand? Now checking temperature. So as I can see, the skin color, it ranges from light brown to brown, which is normal. The temperature is warm, no signs of edema and lesions. The hair distribution is equally distributed, and the skin texture displays a rosy, smooth texture, and the skin elasticity is good. So next is inspect the peripheral veins for presence of superficial veins. See the other side, sir. So next is palpate the radial, ulnar, and brachial pulse individually and bilaterally. So, sir, check your radial pulse. Your ulnar pulse. So next is to assess for capillary refill, which is this indicates the peripheral perforations and reflex cardiac output. Sir, can you see your fingertips? The other side, sir. And next is to perform the Allen test, which is block both arteries, which is the radial and ulnar. Clench the finger. Clench the fingers. Sir, clench your fingers, sir. Then, unclench the fingers. Can you unclench your fingers, sir? And then, release the pressure on the ulnar artery. And repeat the procedure on the other side of the hand. Okay, sir, can you clench your fingers? Unclench your fingers. Okay. Next is to examine the lower extremities. Inspect the peripheral veins in the legs for the presence or appearance of superficial veins. Sir, can I see? Next is to palpate for femoral, popliteal, dorsalis pedis, and the posterior tibialis individually and bilaterally. So first, we will be palpating the femoral. So, next we will be palpating the popliteal pulse. So, sir, can you... The other side. Can you put that? Okay. Next is the dorsalis pedis. The other side. And next is the posterior tibialis. The other side. Okay. Next is to assess the peripheral leg veins for signs of ulceration, varicosities, and thrombophlebitis. Next is to inspect the calves for ulceration, varicosities, redness, swelling over vein sides. Sir, can I check? Okay. Other side. Okay. Next is to palpate the calves for firmness or tension of the muscle, the presence of edema over the dorsum of the foot, and areas of localized warmth. Push the calves side to side to test for tenderness. So, checking your calves. The other side. Okay, that's good. Next is to firmly dorsiflex the client's foot while supporting the entire leg in extension, or had the client stand or walk. Sir, can you stand up and walk? Start to walk. Here you go, sir. Okay, sir. Can you walk? And again. Okay. That's good. And next is to assess the capillary refill for both legs and repeat the preceding steps with the other side of the other leg. Now into the other leg. Okay, Sir Kian, the assessment is all done. The results of the assessment are all normal as you engage into a healthy lifestyle. So, as I recommend, you should avoid smoking, limit your intake of alcohol, and avoid foods that are high in fats. You should continue to engage in exercise, get enough sleep, and eat healthy foods. So thank you and see you to your next assessment.